Welcome to Voices for Impact, the podcast. Started during the COVID-19 pandemic and made in Syracuse, Voices for Impact is full of conversations with thought leaders from around the world that have made significant accomplishments in their lives and have gone through their own challenges, but have made it through those adversities and made positive impacts through their work. I'm your host, Danielle Mensing, and as a fundraiser for a nonprofit, I believe the most valuable tool you can give yourself is making a positive impact on others and your community. Every conversation is going to give you tools and tactics from entrepreneurs, athletes, artists, and change makers that will encourage you to develop a growth mindset and reimagine how you can find your purpose. Now let's get started. This episode of Voices for Impact is sponsored by Kefi Marketing, locally woman-owned and operated by Katina Carl, a marketing, advertising, public relations, and social media marketing company that creates marketing campaigns that are filled with innovative thinking, successful mindsets, and creative solutions, all while putting kindness, positivity, and heart into every campaign they're a part of. Look no further than to bring Kefi Marketing to that table for all your marketing needs. Contact Katina Carl, owner of Kefi Marketing, at katina@kefimarketing.com, online at www.kefimarketing.com, or on social media at Kefi Marketing. If you would like to sponsor an episode of Voices for Impact, contact us through Facebook, Instagram, or LinkedIn. Now back to your regularly scheduled programming. Welcome to Voices for Impact. My name is Danielle Mensing, founder of Voices for Impact, and today I'm chatting with Nichole Cavallaro. Nichole is a licensed mental health therapist who currently works as an online provider. She is on Talkspace, and she has her own private practice, which is also all online, called Mental Health and Wellness Therapy. She writes for Syracuse Women magazine, contributing to the health and wellness section, and serves on the board of Ophelia's Place, an eating disorder clinic in the village of Liverpool, which is also connected to Cafe 407. Thank you so much for having a conversation with me today, Nichole.
Thank you. So happy to be here.
So 2020 has been a very crazy year. And for
Yes.
you, especially as a mental health therapist, I'm sure your private practice, I'm sure, has thrived, but also it's been chaotic for you because your patients are in crisis due to this pandemic. So my first question to you is, how has the pandemic affected the mental health climate?
I think it's very safe to say that it has inflamed it. And when I use the word inflamed, I mean there is a collective sense of like a collective sense of inflammation of what's already existed. And so if there has already been a situation where someone has been battling with depression or anxiety or postpartum anxiety or depression or anything else for that matter, I feel like it's been inflamed by this pandemic because the situational factor at hand is such that it's a pandemic and it's very limiting in so many ways. Crisis is the right word. I have definitely heard many patients of mine, and when I say here, I mean on an online platform where I don't see them. I have on Talkspace, I can hear them through voice messages or read what they say. And it's been very difficult. It's gotten a little better, but I will say in the beginning of all of this, probably ending in early June, that is when things started to slow down. 100% of my patients are from New York City. Mm-hmm. And so as we all know, that is, I don't know, at this point, was the epicenter when this all happened. And I was hearing it. I was hearing a lot of frantic messages, crying, just it's been very difficult, you know. I think it's been limiting as an online provider because you can't do much except hold space for them and validate them and reassure them and be there for them, but reassuring them with what really, like, what am I going to, it's very hard to reassure someone of their pain when they're in the midst of it and when I'm in the midst of it too. So that was very challenging for me as a provider. I've never, a lot of us providers have never been trained to be kind of in this situation. We've been trained for crises. But again, Talkspace and my practice isn't that of a crisis platform. So it's different from a crisis hotline. It's ongoing treatment. And this was ongoing pain.
Mm-hmm. Now, how has this pandemic affected people with already coexisting mental health issues?
So things that have already been there, let's just say alcoholism it was a big one I've seen. Those who have been on the road to recovery, which is an article I just wrote, recovery in itself is extremely difficult for someone because it's every day. With this happening, depending on the person, whether they've lost a job, a loved one, obviously they're limited to doing things. There has been more time for people to use. And I've run into that where patients have been drinking more, or they haven't been able to go to a meeting, or they haven't been able to go to group therapy. A lot of things were online. It's not the same for some, but a lot of people have, in my experience with this, have kind of resorted to drinking more because, frankly, on the one hand, there's not much to do. On the other hand, they need help. And depending on their situation, it is scary for them.
Now, you said earlier it's kind of quieting down a little bit. We're getting into summer, especially in New York. Things are starting, are reopening, whereas other states, as we know, are doing the opposite of that. So, my concern, your concern might be as well, like when fall comes and there might be a second wave of this, and we go back into where we were in March, potentially, what is some advice that you might give people, that are listening to this, that might be worried about that as a potential thing that's going to be happening? What are some also tips for people as if this were to happen again in the fall?
I can only speak to what I've done or what we've learned. Really do what you've been doing before COVID. I mean, if being healthy, obviously, it's everybody wants to be healthy, and I think before this, I've always been true to keeping my daughter out of school if she was even had the hint of a cough. She has asthma, so if she gets sick, it's longer for her to get over things.
Right.
So my general practice as a parent was to keep her out as much as I could, give her a bath after school or a shower that night, have her wash her hands, still practicing the hygienic daily skills that we're supposed to be doing every day, right? And just to keep enforcing that. I would say just kind of stick to those things that have worked for you or that give you a peace of mind, because when you're in this kind of climate or when you're in a situation that you can't control, you need some sort of peace of mind, and you need something there to manage. And it's the same with anxiety. My tips or my suggestions on how to cope with anxiety last year are the same for this year, because anxiety isn't, no one's immune to that. To some extent. So I think keep on doing what you've been doing. Stay off social media. That has been the number one trigger I've heard in so many people, where social media, ironically, is something all we have now. Right. And now literally everything is on social media. And I would say maybe a year ago, social media was just very consuming for people, right? And still there are some things that you should just stay off of and not look at. But especially now when it's so tender, when things are so triggering, when there's been so many things happening month after month, and within limitations, political or not political, A, B, and C, really just bring it down a notch and figure out what it is that works for you. A lot of what I've seen and heard and read and written about is a lot of us are operating at a very high macro level of collectively trying to understand this massive loss on a world scale.
Mm-hmm.
And it's pretty impossible to operate at a world scale when you are kind of in your own world trying to figure out what is best for you. So my suggestion is stay off social media, bring your macro level of the understanding of fixing the world's problems and kind of bring it down to a micro level of fixing your world, your inner world at home, with yourself, with your family, with your job. That is what's going to save you, because worrying about everything else is noise. Honestly, it really, really is. It's noise. News has always been noise. You just have to be sure you're receiving it and filtering it in a healthy way. I'm not saying you can never be on social media. What I am saying is be mindful of what you're reading and what you're willing to accept into your head. You don't want to read about the constant negativity going on. How is that going to help you function through that day or the next day as a parent or someone who owns their own business?
Yeah. I think that's a really great point you made, because it's not just social media too. It's just listening to the news or hearing people talk about it at work if you're back to work, or, that's the first conversation you might have with somebody that you haven't seen in a while is, wow, this year's been crazy. And then there might be a 30-minute conversation about COVID-19 and how life has sucked. So you can't really escape it. But that's a good tip, is to just think about your own self, your work, your family, and the immediate things that you can control in your immediate environment, not worry about saving the world's problems when you hear, and see on social media everything that's going on politically. It's a lot.
It really is. It gets messy. It gets loud. For someone with anxiety, this is too much for them. It's too much. And that's not to say they can't handle it. That's not to say they have a problem or a weakness. It gets to be too much when you can't function as a business owner, a person, a parent, a teacher, a student. Speaking of students, these children are probably wondering what the heck is going on, because everybody is acting different, and I'm sure they understand and they get it, but their lives are going to be impacted, if not already. I mean, they're already impacted. I'm just going to say it. They're already affected.
Right.
And there's no way you can quietly discuss this. It's like the parents fighting quietly and they don't want their kids to hear it. These kids are hearing this loud and clear because they know something's different, and adapting to that in a healthy way. I'm praying a lot of children are trying to adapt to that in a way, and that's kind of on the parents' responsibility too. And I think what you had said is a good point. Going back to work and probably having those conversations for the first time because you're with someone social now. What are we going to talk about? Let's just talk about the last 7 months. And I think that can be okay because it's a release. Mm-hmm. So I would absolutely support, I would say if you need to talk about it, vent, do what you need to do, right? I think that's good too. It's only problematic when it becomes obsessive and it becomes something that's leaked into your everyday life and in your mind and stressing you out to where you cannot function the best way you can. So
what advice would you have for people to just keep a positive mindset, not only during this COVID-19 pandemic, but in a normal year too?
A positive mindset. That's a hard one because there is a significant low morale that I feel everywhere. I feel it when I mask up and go to Target. There is a low morale in the drive-thru. It's really difficult seeing a lot of people out and about and they're still kind of affected by all of this. Mm-hmm. And for me, I see it and I sense it. I don't know if anybody else does. Maybe it's always been that way and I didn't know.
And now it's just heightened.
Yeah, it's just heightened. Again, it's inflamed. Everybody's mad because they should be. I think one positive thing is really finding something in the day at home or with someone that brings you some piece of joy. You know, hang on to something or hang on to someone that makes you happy. You know, seek out funny TikTok videos or seek out something funny to read or something good to read or connect with an old friend. You know, these are things you could do anyways, but really reach for those things that put you at ease, that make you happy. But understand, if you don't feel happy and you don't feel positive, that's okay too, because that's a normal reaction to something so significant. You know what I mean? I struggle with that myself. I'm always like, all right, Nichole, you're a therapist, like, get it together. You know, like, you know, we got to spread the word, you know, keep it positive. And sometimes I'm okay with not keeping it positive, because sometimes it's just good to hold space for someone, because sometimes they don't want to hear it. They don't want to hear positive messages sometimes, but sometimes they do, you know? You know, whether it's faith, whether it's, like I said, family, whether it's going outside and doing different activities for yourself, whether it's picking up a different hobby, collecting something, you know, joining an online community that makes you happy. Those are things that are still doable. You can still do things to make yourself feel happy in a healthy way. Again, don't have the expectation that it's going to be, you know, rainbows, because it's just difficult now. This is a very bizarre situation. I think for me, and I think my dad and a couple other friends, you know, we've just kind of walked, you know, in the woods or by the lake, and really being mental health wise, you know, it's a good skill to have when you're kind of in your headspace a lot, and you have a lot going on in your mind. You know, it's a good idea to go by a big piece of nature, or be consumed by something that's bigger than you, that's naturally there. You know, if you think about it, I mean, I think that's why people love to go on hikes, or they see mountains, or they travel to see different, the process is interesting, and the process is very therapeutic, but it's nature consumes you. And so there's something bigger that is, you know, kind of embracing you in a way. It's almost like a, I don't know, a hug, I guess. Yeah. But it does work for some people. Yeah. I would say this isolation for people in their homes is definitely not healthy for mental health reasons. Isolation is, it can definitely be seen as symptomology that is concerning to me. If it's already been done, like if someone's an introvert, great, they were born for this, but then again, it's not even good to stay in your home every day away from people. That's something that's a bit extreme. Right. So you want to be mindful of extremities. You know, if you're staying home, great, but make sure you still have some sort of interaction with someone, whether it's text. I'll text my best friend, I'll text my sisters, you know, I'll reach out to people, you know, I've reached out to you, and so it's, it matters to connect. We're humans, we need to connect. This was very limiting to us. Yeah. I always say you have to have a routine. You have to have a routine. I'm not saying plug every day full of 8 hours of stuff to do. Yeah. You know, I'm saying make it a point to schedule one thing in a day or a week. You have to have a routine. Get up. If you lost your job, I know what that feels like. I know exactly what that feels like. It's horrible and it's traumatizing. Even if that's the case, or even if something else happens in the fall, but like it did happen in March, have a routine. Get up, get showered. You know, you have to behaviorally do these things, and you have to cognitively understand that those things still need to happen. This is how people fall into a deep depression, or a deep kind of just bad place where they stop doing things. And although I understand when that happens, it's hard to crawl out of those things when you don't have a tiny plan, when you don't have a routine to go to, a structure. Structure is such a safe web. Structure is, it's like a safety net, you know, and don't expect it to complete you for the day, or make this big drastic change for you, or save you every day, but it can be something that can anchor you in the day or in that time. I know back in March, a lot of people were in their apartments in New York City. And if you've been to New York, it's very crowded there. And a lot of them have been in their apartments for 3 months straight. And myself would be there. That person and myself would be the only interaction they had, along with calling their parents or friends. But it definitely did a number on people because they were in their homes, and a lot of them, did exercise videos. They joined programs online. They, connected with people. They had those Zoom meetings that I'm sure a lot of people don't like now.
Yeah.
But they had those things to grasp towards. And, I think as long as you have support, I'm going to probably just underline that and visit, if you have support, like a therapist or someone to kind of talk you through this murkiness, if it happens again, I really think that's helpful. A lot of people think they can do it on their own. It's just a different, bizarre situation. Maybe they can. But everybody needs a sounding board. And I would say if you can find a therapist, or if you can find someone who can professionally hear you and hold space for you, that's going to help tremendously. I think the relationship you have with a therapist is probably one of the most important, intimate, and intimidating relationships you will ever have, because you are fully yourself, right? As much as you want to show and give and talk about, you are talking about personal struggles. You are talking to a professional with insight on the science of mental health. And I'm speaking for myself. I'm very much into the science of mental health. And then I'm into empathy and meeting you where you're at. And it's a wonderful, beautiful balance that I have, and that I hope that people see when they talk to me, because all of that matters. It's not just about talking about your feelings and knowing your secrets and giving you tissues. That's part of it. But a lot of it has to do with understanding the science of your thinking, the patterns of your behavior. And then when you leave the office, how do you take your therapy that you learned and how do you apply it? So the work is also outside of therapy. It's a very holistic, wonderful formula.
Now, where can people that are listening to this and want to reach out to you, how can they reach out to you?
They can go to my website, which is mhwellnesstherapy.com, or they can, if they want a subscription plan, they can attempt to get into Talkspace and privately request me. I don't know if that would be the best way. I think, if you want to get to me personally through my practice, that would be the best idea. If you need referrals, you can definitely hit me up for those too. I know some people in the area who are able to work with a variety of different people. But it's, you can find me on Psychology Today. There's a lot of us mental health workers. That's a huge directory. Everybody and anybody's on it. And if you can't afford a session, if you can't afford therapy, I really hope you read the articles in Syracuse Women Magazine. It's free help, it's free insight, and that's the best you can do for yourself. There's no shame in that either.
So great. Thank you so much for giving us some insight on what you do, some advice. I really appreciate that. And make sure you reach out to Nichole if that's something you'd like to do, is have a chat with her one-on-one. So thank you again.
Sure. Thank you so much. This was fun.
Voices for Impact is on LinkedIn, Facebook, Instagram, YouTube, and now on Apple Podcasts. So please follow, like, and subscribe to stay connected. And I'll see you next time on Voices for Impact.
This episode of Voices for Impact is sponsored by Kefi Marketing, locally woman-owned and operated by Katina Carl, a marketing, advertising, public relations, and social media marketing company that creates marketing campaigns that are filled with innovative thinking, successful mindsets, and creative solutions, all while putting kindness, positivity, and heart into every campaign they're a part of. Look no further than to bring Kefi Marketing to that table for all your marketing needs. Contact Katina Carl, owner of Kefi Marketing, at katina@kefimarketing.com, online at www.kefimarketing.com, or on social media at Kefi Marketing. If you would like to sponsor an episode of Voices for Impact, contact us through Facebook, Instagram, or LinkedIn. Now back to your regularly scheduled programming.